Contact authorities. Here now is Dr. David Samadi. He is St. Francis Hospital Director of Men's Health. Thank you so much for joining us.
Thank you, Melissa.
You know, it's hard to know what to make of the different way people are behaving. You know, as we just said, there's still a 5-hour line for a ride at Disney, a place where, you know, you would think would be majorly impacted by the coronavirus, you know, given that you're in such proximity and you have the opportunity not to go. But then there are other people who are saying, well, there's coronavirus in my town. In New York, for example, maybe I should pull my kids out of school. What do you think? I mean, what's the right amount of caution?
I think we need to be really smart about this. We need to be really vigilant and pay attention. And the worst thing that can happen is the panic and the fear. It's the panic of unknown, because a lot of times people at the CDC and the government, basically they're not giving always clear information, because this virus sometimes behaves very different than what we used to know. And when people don't have all the information, they panic. In my field of prostate cancer or any kind of cancer, when the patients don't know where they're headed, it's a panic and fear. Same thing with this virus. So I think we need to look at the statistics, Melissa. If you look at the pandemic, so a lot of scientists are now calling this a real pandemic because we're seeing this in 73 countries. When you look at U.S., we only have about 129 cases and we have 10 deaths. You're talking about 1% fatality, and that's a very low number. So the risk to Americans today is very low. Are we going to see more numbers in the future? Are we going to see more death from this virus? Absolutely. And it's going to get a little worse before it gets better. The good news for people to know is that the epicenter of this virus in China, in Wuhan, the numbers are slowing down, which is really great news for us.
Yeah.
The travel ban that President Trump put in place was the best thing that he did, because you're isolating the virus. And then, of course, the investment that's coming in, $7-8 billion that's going to go to this, it's going to bring all this screening tests. Yeah. And by having able to screen the patients, we're able to diagnose them, isolate them, and contain them and take care of this. So I don't want public to be panicking about this.
No,
I think this will pass.
What advice, you know, so say I feel like I'm coming down with a cold. I know that the symptoms are, it's respiratory, it's a cough, it's a fever. What would you tell me to do?
I think at the beginning you should observe, because these have very similar symptoms than flu symptoms. Fever is a big thing, but if you're getting short of breath, if you're really having more symptoms of respiratory, you have difficulty with breathing, you should absolutely go get checked. The good news is that 80 to 90% of people that are coming with mild symptoms, they recover on their own. So when we talk about these statistics, there are a lot of people out there who may be positive with coronavirus, but we never get to see them, and they basically heal on their own and they improve. So this is very important for people who have COPDs, asthma, smoking. Certain countries like Iran or China that have major pollution, these are and also nursing home patients, patients that have immune compromise, HIV patients, or if they're on steroids. These are the group of people who really have to be very careful. Someone like you, God forbid, if you get this, you're going to basically heal on your own and you're going to improve. But if you see your fever is going up, short of breath, things are getting worse, you have to go in and get checked. Absolutely.
Is there anything you would avoid right now? Would you tell your family to avoid things?
Well, my children asked me whether we should be traveling or not, and my answer was that we absolutely will go. I think wearing a mask is not going to help us, but if somebody who is coming up with the symptoms, they should be wearing masks. I don't think this is really in a panic zone where you really have to change your whole life and be paralyzed. So we're going to watch this. I think it's going to get better. We're going to see more number of these cases, but in 2 months from now, I think we're going to be forgetting about this. That's my opinion.
Dr. Samadi, thank you for coming on. We appreciate it.